Vaccine mandates have been one of the biggest debates of the last year of the pandemic, prompting a lot of questions to our Verify team. And that's the case both in public and in the courts. Mostly, they focused on things like workplaces, schools, and businesses imposing those requirements. But there's also been the question of whether or not the mandate could apply to the general public. How would that work out legally? The Verify team taking a close look at this tonight. Here's Jay Wallace.
President Joe Biden recently tasked a federal health agency to create a system of vaccine mandates in the workplace. Some viewers have sent us a question related to this. Can the federal government mandate vaccinations for the general public? With Verify, we tell you our sources first. We spoke with 5 professors from health policy and law programs: Christopher Robertson from Boston University, Wendy Parmet from Northeastern University, Dorit Rice from the University of California, Ana Santos Rutschman from St. Louis University, and Stacy Kirshner from Georgia State University. The short answer is no. The government on its own can't mandate vaccines to the general public.
The federal government needs an enumerated power to act in this space. And so that's why it can't just require, every citizen to do it on its own. They have to act through an area where they do have power, like regulating worker safety.
That's why President Biden's administration tasked the Occupational Safety and Health Administration, or OSHA, with creating and implementing a vaccine mandate for America's workforce, not the general public. OSHA exists to provide workplace safety through rules, standards, and inspections. OSHA's upcoming vaccine mandate for workers will be an Emergency Temporary Standard, or ETS, which can only happen if there's the potential for, quote, grave danger in the workplace. Now, because it's an ETS, the mandate can only last up to 6 months before going through the normal review process.
It allows them to bypass the normal Administrative Procedure Act.
In June, OSHA created an ETS for healthcare workers that, in part, regulated face masks, patient screenings, and the use of aerosol products, but did not include a vaccine mandate. The ETS issued in June in response to COVID-19 was the first ETS since 1983. Legally, there's no precedent for the government mandating vaccines for the general public. The Supreme Court case from 1905, Jacobson versus Massachusetts, dealt with a vaccine mandate for smallpox. But in this case, states enforce the law, not the federal government, because states have a constitutional capacity known as police power, allowing them to do this type of mandate. It does not apply to the federal government.
It's not a legal precedent, right? A legal precedent has to be so close to what you're saying that either you're persuaded by it or you're bound to it. We don't have either.
It is true that the federal government has required vaccines under outlined circumstances, such as for immigration, traveling, or parts of the military, but it's always been for specific groups.
The federal government has not historically mandated vaccines for the general public.
So we can verify, no, the federal government can't mandate vaccinations for the general public. However, vaccine mandates may be applied to specific groups under the federal government's jurisdiction, like OSHA enforcing a vaccine mandate for America's workplace. Health law experts say once OSHA provides more details about how this mandate will be enforced, then it will be easier to predict if it will potentially be challenged or held up in court.
And our thanks to Jay Wallace for that in-depth report. On a related note, another question to the Verify team is about if an employer requires that unvaccinated employees get tested weekly for COVID-19, is the boss responsible for paying for that testing? So to get to the bottom of this one, we talked to 3 sources, 2 of them noted attorneys, Stephanie Rapp-Tully and Diane Seltzer. And we also heard from Lawrence Gostin, a law professor at Georgetown University. So all 3 of them said the onus is not automatically on the employers, even if it's the employer who is requiring the testing. The employees may have to pay. Our experts say that that would even be the case for employees who don't get the vaccine because of medical or religious exemptions. They do say, however, that some employers may choose to pick up the cost, and they warn that the rules could change when OSHA issues its final regulations about requiring companies with 100 or more employees to get the vaccine or offer a test out option. That's what Jay was just talking about in the story. Those OSHA rules may include language specifying who will pay for the testing. For now, though, we can verify that it is true employers are not required to cover the cost of COVID testing for their unvaccinated employees. That expense may fall on the worker or the worker's health insurance. That's all the time we have for today's Town Hall. We're glad you've been here. We'll see you back here on Monday. Go Bills on Sunday night. There's our text line number if you have a question or comment. Scott and Mary Alice are back with Channel 2 News at 6 right after this.